I miss my friends. I wasn't able to see some of them because one of my close friends who I've known forever unfortunately got cancer during the pandemic, so I couldn't see her. And then my other friend, her grandma was really high risk, so it was really hard to see her at all.
Right,
So I'm really excited to finally be able to give them a hug
right.
or even just see them.
But Leanne, right? And look at that. That's a sacrifice you made at the time for somebody else, right? And the same concept applies for getting the vaccine. People argue, well, it's not very much a risk to me, so why do I need to get it? But the reality is, it's a risk to others too, and by you getting it reduces their risk. So, you know, it's a simple explanation that I think will appeal to most people.
I know you kind of talked about it about kids who have sickness or going through cancer or did go through cancer or still battling it. So another question I have is there a possibility that the side effects of the shot may be worse for them if they had cancer or another sickness?
Um, Probably not. If anything, they might be less because if they are immunocompromised, then they're not going to develop as much of a response. So remember, I almost feel like we should talk about them not as side effects, but actually intended, right? So, you feel a little crummy, and we want that to happen to some degree because we want, it's in some ways reassuring, I guess. Okay, I feel a little crummy. That means my body's responding and making antibodies. When you first get sick, that's what's happening. Your body's ramping things up.